Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Dr. Fred Venditti, our hospital system and general director. Today is Thursday, December 2nd, giving you the update from Albany Med. And Fred, it feels like about 6 months since we did this.
Yes, well, we've missed at least last week with
Thanksgiving, and I think the week before.
You missed the week before. I was here.
All right, I know you were there. All right, let's jump into the numbers. First graph, New York State, people in the hospital with COVID. That number is 2,992. Next graph here is Capital Region. And again, week over week now, clearly a change from the week before. We'll talk about this in greater detail. That number is 294.
That's right.
In the hospitals of the Capital Region, currently diagnosed with COVID. Next graph here is Albany Medical Center admissions and discharges. You can see, Fred, we're kind of now more like 10 per day, sometimes coming in.
Right.
Very similar number going out, but incrementally we're seeing that number going
gradually
up.
Starting to creep up. We had been hovering in the 30s, Dennis,
Yes.
and now we've hit 50.
Well, here's that next graph. So
Yes.
here's the morning census at Albany Medical Center, currently 53 in the hospital diagnosed with COVID. Let's do that breakdown. Fred, of the 53, you were just giving me these numbers. 14 are in the ICU. There are none on ventilators.
That's right, Dennis.
We're going to talk about that in a second. Of the 53, 4 of them are adolescent or children.
That's right.
And over the last 7 days, when you look at the people who came into the hospital diagnosed at Albany Med with COVID, 80% continue to be unvaccinated. That's a number we've talked about many times. That continues to be the case?
It remains the case, Dennis. So this continues to be an issue with the unvaccinated population in our community.
Because we know that there are other viruses out there, and we often see those numbers go up in the winter months. We're going to talk about these as well. Influenza, we currently have none in the hospital.
That's right.
That's a trend we saw last year as well. We'll see if that changes. We do know there is some influenza in the state, but not a lot.
There have been a couple of cases in our region. I think St. Peter's has had a case. Nathan Littauer has had a case, and I think there's been a case in Glens Falls, but not here at the medical center.
And then there's another virus, RSV, which, as we know, primarily affects children. And what's the number here?
I think, Dennis, the last I looked, we had 9 children in hospital, and that can really make children very sick. At one point, 3 of them had been on a ventilator.
Right.
All 3 of them are off the ventilator, which is great.
That is great news.
But they can get very sick with RSV.
So, Fred, going back to the number that are in the hospital, that are in the ICU, or on ventilators. So we know currently today there are none on ventilators. What do we think about that? Now, obviously, tomorrow we may have some on a ventilator. We may have 2 on a ventilator. But the fact that there are none out of 53 is different than what we saw perhaps in the first or the second wave.
That's absolutely right, Dennis. So if you think about it, what's different between now and that second wave or the first wave is the vaccine.
Right.
So we know from everything we've seen now, the controlled studies and just our experience, what the vaccine does is it shifts to a more mild disease pattern. Some people are completely asymptomatic. They have no symptoms. If they do have symptoms, they're relatively mild. So it causes fewer people to be hospitalized, fewer people to be in the ICU, fewer people to be on ventilators.
All right, very good. And then we were also looking at some other numbers. As we go back to that first graph that shows the Capital Region number of cases going up, one of the questions that people might ask is, as the cases go up, what percentage of those cases actually land in the hospital? And you can work into a number when you look at the total number of cases identified per day and the total number that actually land in hospital beds in the Capital Region. And that appears to be about 2 or 3%, Fred?
That's right, Dennis.
So if you do get COVID, it's about a 1 in 50 chance that you end up in the hospital. If you do, number one, there's a high likelihood you're unvaccinated.
That's right.
And then even if you are vaccinated, it's still primarily those that are older with those underlying medical conditions.
So Dennis, I have a question for you. This is a fun fact.
Okay.
I didn't tell you ahead of time.
Oh no, here we go.
What percent of the population of the United States has had COVID so far?
Been diagnosed with COVID?
Been diagnosed with COVID, yes.
Let's see, I'm going to say 25%.
15%.
15%.
15%,
Okay.
48 million people.
Okay.
So pretty significant number.
All right, it is absolutely a significant number. All right, very good. Let's show the next graph here, which is variance, and we've talked about this before. When you look at the graph and you look at the samples that are sent over to the Wadsworth lab, it's essentially all Delta.
Still Delta. Now, this is a trailing indication of
Right.
what's happening, Dennis, so it takes them a little while to get the samples in process. So this doesn't really reflect what's happening necessarily today or even this week or last week, from that matter.
All right.
So, and obviously there's news about variants.
Omicron.
Omicron.
Omicron. So let's talk about that, Fred. For those who are watching the video, I'm sure they've heard about it in the news, but if for some reason they've missed it, where was it first identified?
So it was actually first identified in South Africa.
Right.
There's some speculation that it started in a patient with HIV who was immunocompromised,
Right.
and for 200 days had positive COVID tests.
Right.
And so think of a petri dish, allowed it to mutate and mutate and mutate. But it spread from there to other countries in the southern part of Africa, Europe, Hong Kong, Australia, and now in the United States.
And I think we've heard now there's a second case identified.
There's a second case reported this afternoon, someone from Minnesota who had been in New York City. So very likely now, I think we're going to begin to see this in New York State in the samples that go to Wadsworth.
Now, when Delta first emerged on the scene, it was a similar story. We heard about it. I believe it started in India at the time. Do I have that correct?
I believe that's
and
correct.
And then it's
yes.
spread. And so certainly we would expect that perhaps to be the case here. The real question which has been asked is this particular strain more virulent or not? Or will the vaccine work against it or not? And I think at this point, we're still waiting to find out.
Yeah, Dennis, I don't think we know yet. So there are some studies being conducted right now to see if convalescent plasma affects the virus. It's going to take a couple of weeks for us to understand that. So we don't know about the effectiveness of convalescent plasma and by definition vaccines, but we'll know shortly. In South Africa right now, there's been a pretty rapid increase in this virus and cases related to this virus, but not really a big increase in hospitalizations.
Good.
So it's too early to say for sure, but the early indication is that perhaps it's not as virulent as Delta.
Well, obviously, as you've said many times, there are points of data that sometimes lag. So first you have identification of cases, then you have identification of hospitalizations, then you may have identification of people who end up in ventilators or in ICUs. So we'll see.
That's right.
And obviously we'll need a couple more weeks to do that. When it comes to what we have now in the area, we know it's Delta. Let's pop open the next graph here. This one we've looked at in the past as well. What is the effectiveness of the vaccine in preventing hospitalizations? And the good news there is that although Delta is the strain in the region, the vaccine still appears to be effective.
That's right, and it's the black line on the top of that graph that is the percent effective, and it's still hovering around 90%.
Which is great news. So for those of you who have not been vaccinated, again, we still encourage you to do that. In the capital region right now, Fred, we're like just short of 800,000 individuals who've been vaccinated. So that's a remarkable number. But in a population base of 1 million or more, that means there's still potentially 200,000 that are eligible who have not gotten vaccinated yet.
That's right.
So we encourage you to do so.
Vaccinations are important.
Fred, the executive order came out this week from Governor Hochul.
Yes.
People may have read that in the paper. They may have seen some area hospital names on there, and whether or not those hospitals would have to slow down what they're calling elective procedures. We've talked about this in the past. Some of these procedures may be deemed elective, but they're perhaps better called non-emergent. These are still very important procedures that these patients have.
That's right.
Where do we stand on that?
So Dennis, I think the governor is trying to make sure that there's enough capacity in the system, in the regions and even at the hospital level to care for any surges that might happen. And so for us right now, in the recent past, the past couple of days, we actually have at least 10% capacity, staffed capacity, that we could manage a surge with. And we're able to go even beyond that if we had to within 24, 72 hours. And all of these are questions that we're asked by the state every day. So it's in their database.
So for people who may not fully understand that, we have a hospital, we have beds in the hospital, we have staff taking care of patients in those beds. And the state wants to be sure that if for some reason we had to increase that by 10%, we could do so. And that's the metric by which they measure this elective surgery.
That's right. And Dennis, you know this. In the course of 24 hours, our census varies greatly.
Oh, sure.
And we're able to staff up and down, literally shift to shift, to manage our volume.
Absolutely.
So I'm very confident that we'll be able to deal with any surge that would come at us we're paying a lot of attention to what's happening. We're talking to the other hospitals in the region. We've been through this before. So I'm very confident that we're going to be able to do everything we need to do. And right now, I don't think we're going to have to cancel any elective surgeries or procedures here at the medical center.
That's excellent news, and we hope that continues to be the case. And to the extent that our staff are managing those patients, making sure that they can be discharged when they no longer need to be in a hospital bed to the next level of care appropriate so that we keep those beds open, we thank you, because that keeps our ability to care for those new patients.
It's important. And Dennis, we didn't show the length of stay
Right.
graph this week, but it has creeped up.
Right.
Some of it's outside of our control. Nursing home placement's gotten real difficult. But anything we can do to keep that number down, it creates capacity. It's important.
For sure. Okay, let's do some recognitions, which is always fun. So I was heavy on some COVID, which is important, of course. But so it is that we recognize members of our workforce. So we have 4 different individuals to talk about. I'll do the Eye Care Awards, and then we'll flip it over to you, Fred, for the Daisy. Let's pop open their pictures. These are individuals most recently recognized for the Eye Care Award, compassion, accountability, respect, and engagement. And we had 2 incredible individuals that we recognize. William Fuller, who is a support team associate in patient transportation, and Maggie Goss, cardiorespiratory services supervisor. Fred, they both came down at Center Combined Leadership meeting. They were both fantastic. Both spoke really from the heart about why it is they do what they do. And obviously, they're highly deserving of this award, and we congratulate them for that.
Thank you for everything you do.
And then the Daisy. The Daisy
The
Award.
Daisy. So the Daisy Award, just to remind people, patients and families nominate nurses for this award. And there are a lot of nominations, so there's pretty stiff competition. So the Daisy Award this month goes to Katie Seiler in the PZD. Katie is a nurse in the PZD. She was nominated by the parents of a 4-year-old child who said Katie's compassionate expertise guided the family through the frightening period of time when her daughter was having a seizure. They reflected, quote, Katie made a scary situation so much better by the care she provided. Thank you, Katie, for your commitment, your compassion, your expertise.
I love it. Congratulations. You know, what you just said is so true. Taking scary situations and make them less scary is something that a lot of our providers do, and that's very important.
You know, for us, Dennis, some of this stuff is kind of old hat. It's a weird way to say it, but we see so much, you know, to be able to impart some comfort to people and taking the anxiety down, I think is really important.
And speaking of individuals who take stressful situations and make them less stressful, if you've not had a chance, we encourage you to check out the newest video, Inside Albany Med, with Mr. Fred Clark. I call him Mr. Clark. He's one of our security officers. And it was a fun interview that I had with Mr. Clark. And we learned a lot about him. And I'll let you watch the video. But one of the things that we talk about in that video, Fred, is that he likes to put together Legos.
Really?
Yes.
He's a great guy.
Do you like to do Legos?
I can't say that I do.
Did you do it with your kids?
A little bit.
Oh, I love to
Mostly
do
I stepped on my at night on the kitchen floor.
We talked about
barefoot.
stepping on Legos as well.
Yes.
Anyway, it's a great video, and we congratulate Mr. Clark for that as well.
Congratulations.
So that'll do it, and we'll be back again next week. I know we're here. We missed last week because of Thanksgiving, but we'll be back again next week. To all the members who are working here this weekend, we appreciate you now more than ever, and we'll be back again next week. We ask that you once again, please take care of yourself, take care of each other, and we'll see you next week.